6-year-old man presents with flu-like symptoms. So in the question there are some clues which you should identify. Flu-like symptoms are present and there is a palmoplantar rash. Palmoplantar rash is present and the question mentions that there was no history of Chancre. On examination he has Epitrochlear lymphadenopathy. So whatever I have highlighted, these are the clues, and if you observe the image, so in the image what you are able to see, palms are showing hyperpigmented macules and hyperpigmented patches. So hyperpigmented macules and patches are seen, and so these are all the clues, and with this you should identify the diagnosis, and you should also identify which of the following is the likely cause of this presentation. So you should also know what is the etiology of this particular condition. And with these clues, and most importantly with this clue being mentioned in the MCQ, epitrochlear lymphadenopathy, the only diagnosis which you should think about is syphilis, and that too specifically secondary syphilis. So by looking at this term syphilis, you might think that it is a sexual contact, so answer should be option A. But if you observe, the question mentions one important clue, that there is no history of any Chancre. So that rules out any sexual contact. As a cause of this presentation, and it is not an endemic disease, and no, syphilis does not get transmitted from just skin to skin contact. Intact skin to skin contact will not cause this condition syphilis. If there is any like for example Condyloma lata, those lesions which are having some form of disruption of the skin, that is they are having some erosions, through that the Treponema pallidum can transmit to another person who is having some erosion or ulcer, and then there can be possible presentation in the form of syphilis. But otherwise intact skin to skin contact will not occur. So you are left out with option B. So by at least ruling out the options, you will be able to answer this question rightly as direct secondary syphilis following blood transfusion. This is having a special name. We'll see that in the next part of the video. Okay. So before that, let us quickly see what is the natural history of untreated syphilis. So you might have heard this. So there will be inoculation. So quickly we'll go through this. Inoculation during sexual intercourse, which is unprotected sexual intercourse, and there is going to be presentation in the form of primary syphilis, which is nothing but Chancre, whereby there is going to be a single painless button like indurated ulcer will be present over the genitalia. Okay, so this stage, even if it is untreated, it will heal, and the Treponema pallidum are going to get disseminated through the blood. Hematogenous dissemination will occur, and if the patient is untreated, after 2 to 12 weeks approximately, the patient is going to manifest with secondary syphilis, whereby the patients are going to have clinical features in the form of malaise will be there. The patients are going to have hyperpigmented macules and patches over the palms, which are called as palmar syphilids. They are called as palmar syphilids, and most importantly, there will be generalized lymphadenopathy, no doubt, but epitrochlear lymphadenopathy is the classical presentation in the case of secondary syphilis. Okay, so that is the reason why here the diagnosis is secondary syphilis, no doubt, but since the sexual history, sexual history is not mentioned, also there is a mention that there was no Chancre, then you should think about this special entity which is called as Syphilis D. Emblee. Syphilis D. Emblee, it is actually a very unfortunate thing where the patient did not acquire the Treponema pallidum through the sexual contact, but during blood transfusion, if unfortunately the blood is, the donor has this syphilis, had Treponema pallidum in the blood, then the recipient will not have any primary syphilitic stage, that is there will not be any chancre. Directly there is going to be trigonopallidum in the blood, and thereby the manifestations will be of secondary syphilis directly without any chancre. This is called as syphilis D. Emblee, and this is also one of the previous year question. You should have an idea about this syphilis D. Emblee. So basically sailors previously historically used to handshake in this manner. Why? Because the reason is they wanted to diagnose whether the opposite person was having any infectious condition. And what is it infectious condition? It is syphilis. Secondary syphilis, which is non-scarring it is moth-eaten alopecia. It is non-scarring variety of hair loss which is seen in secondary syphilis. And I have told you that maculopapular rash is the earliest rash. It fades away, leaving hypopigmentation around the neck, which is called as leucoderma syphiliticum, or it is also called as necklace of Venus. So leuco is white, and derma is white skin due to this syphilis, and it is also called as necklace of Venus. So please try to answer. The last option is pityriasis versicolor. I thank you so much, friends. Myself, Dr. Maddineni Srinivas. Happy learning. Sarvam Sri Krishnarpanam. Sarve Jana Sukhino Bhavantu.